Hi, my name is James. I'm reporting on a 45-year-old male who comes to the clinic complaining of lower back pain. He's a computer programmer. Uh, Pain started about a week ago, um, and he takes ibuprofen intermittently, which seems to help with the pain. For history of present illness, additional questions that I would ask is uh, when did the pain occur? Was it sudden or gradual? I would ask him to point exactly where the pain would be, and then what activities he does, or how bad the pain gets when he does not take ibuprofen, and when he takes ibuprofen, how much it decreases. I would ask also whether the nature of the pain, whether it's burning, stabbing, whether it radiates to the buttocks, thighs, and how far down does it radiate. I'd also ask what are the associated symptoms that occur with the pain? Does it have cramping or tingling or numbness, or loss of muscle tone? Um, when the pain comes, is it regular? Is it all night, where it is more painful during the night when he's resting? Or does it come on in the morning, progressively gets better during the day, or worse during the day? I would ask those kind of questions. And finally, I would ask him how he understands of the pain, or what could be the causing the pain. For general uh, review of systems, I would check the skin. I would also assess the abdomen, palpate the abdomen, check the aorta for maybe aortic dissection. Um, I would also uh, do the neuro check to see whether he has. I'll ask him to whether he's had any numbness or tingling. I'll also ask him whether he has muscle aches or pains and unusual masses noted anywhere. I'd also, for general, ask him whether he has fever, chills, or malaise. Some of the history questions I'd ask would be whether he has congenital diseases, arthritis, scoliosis, cancer. Also, in the family, I'd also ask the same questions. I'll also ask the medications he takes, whether he takes corticosteroids or IV drug use. Um, this is for his past medical history. I've asked him whether he's had any falls, any previous surgeries, any chronic diseases such as uh, fibromyalgia, osteoarthritis, any neurological problems or cancer. Um, I'll also ask him whether he's had in the past any scoliosis, bulgum, any incontinence with urine or bowel, and this is to see whether he has CODA. Social history includes hobbies, alcohol use, tobacco use, cigarettes, recreational drugs, including IV drug use. For physical exam, vital signs, then I would also check the general appearance, gait, distress, skin. I'll also check for dermal cyst. I'll observe and inspect for irregularities of masses. I'll palpate the spine, paravertebral masses, looking for pain. I'll also do the fist percussion over the CVA to look for pyelonephritis. I'll do a range of motion on the spine, asking him to extend and flex, adduct and abduct, the hip, knees. Also, I'll do the straight leg raise, both legs. I also check for muscle strength and also sensory function for uh, for both legs, upper and lower, and the hip also. Deep tendon reflex to see for symmetrical of the knee and the ankle, Babinski sign, uh, and also finally I'll check the gait assessment and abdominal palpation. The differential diagnosis that I came up with were musculoskeletal strain, which is most likely the diagnosis because of his lower back pain, history of new activity, and then pain relief with sitting. Um, some of the other differential diagnoses that I came up with were herniated disc, um, sciatica, spinal stenosis, and cannot afford to miss would be a Cauda equina syndrome. Plan of care for musculoskeletal strain will be no imaging today because the pain is decreasing on its own with ibuprofen. Had considered PT, but pain is decreasing in range of motion, and range of motion is more possible now that the pain is decreasing. We'll consider imaging if pain does not go away in 4 weeks. Labs, none. Prescription medications will continue with analgesics and NSAIDs such as ibuprofen. Teaching limit physical exercise for 2 weeks and gradually increase again. May use heating pads for 20 minutes. Go to ER if acute abdominal pain increases or pain radiating to either one of the legs. And then follow up in 4 weeks. Thank you very much. That's the end of my report.